Welcome back to the channel. Today we are diving deep into one of the most commonly prescribed diabetes medication, Glucophage SR 500 mg. This video will be your ultimate guide to understanding everything about it, how it works, how to take it, possible side effects, comparisons with other medications, dietary precautions, and much more. At the end, I will also be answering the most frequently asked questions to clear your doubts. So, if you or your loved ones are using Glucophage SR 500 mg, you are considering it, then stay tuned till the end. Let's get started. So, let's start with the basics. What exactly is Glucophage SR 500 mg? So, Glucophage SR 500 mg is a sustained release formulation of metformin, which belongs to a drug class called biguanides. Now you might be wondering, what does sustained release mean? Sustained release means the medication is designed to release slowly over time instead of all at once. This is important because it helps in better blood sugar glucose control throughout the day and reduces side effects like stomach upset that are commonly seen in the regular metformin. Regular metformin is absorbed quickly, which can lead to sudden spikes in drug levels, increasing side effects. But the glucophage SR, the drug, is released gradually, making it gentler on stomach and requiring fewer doses per day. So, if you have been prescribed Glucophage SR 500 mg, it's mainly because it provides steady and prolonged glucose control with fewer side effects. Now that we know that Glucophage SR 500 mg is, what is? So let's break down how it works inside the body. The first major action of glucophage SR is that it reduces glucose production in the liver. Normally, your liver makes glucose even when you are not eating. This is called hepatic gluconeogenesis. However, in diabetes, the liver produces too much of glucose, leading to high blood sugar levels. Glucophage SR inhibits this kind of excess glucose production, reducing fasting blood sugar. The second action is that it helps your muscle and fat cells absorb glucose more efficiently. In type 2 diabetes, cells often become insulin resistant, meaning they do not respond well to insulin. Glucophage SR improves insulin sensitivity, allowing glucose to enter the cells more effectively and lowering the blood sugar levels. The third mechanism is that it slows down carbohydrate absorption from food. After you eat, carbohydrates are broken down into glucose in your intestines. Glucophage SR reduces the rate at which sugar is absorbed, leading to a more gradual rise in blood sugar after the intake of meals. Now let's move on to the medical uses of Glucophage SR 500 mg. Primary use type 2 diabetes mellitus. Glucophage SR is mainly used for treating type 2 diabetes mellitus, which is a condition where the body does not use the insulin effectively, leading to high blood sugar levels, and it helps keep blood sugar under control and reduces the risk of diabetes complications like heart disease, kidney damage, nerve issues. Now, PCOS. Glucophage SR is also prescribed for women with PCOS, a hormonal disorder that often causes irregular periods, insulin resistance, and weight gain. By improving insulin sensitivity, it can regulate menstruation cycles and even help with fertility. Now, prediabetes. If someone has slightly high blood sugar but is not yet diabetic, doctors often recommended glucophage SR to prevent full-blown diabetes. Studies show that it can reduce the risk of developing diabetes by 30 to 50%. Now, weight management. Some patients experience weight loss with glucophage SR due to its effect on insulin regulation and appetite control. However, it's not a magic weight loss pill. It works best with diet and exercise. Now, gestational diabetes. In some cases, glucophage SR is used during pregnancy to control the blood sugar levels if insulin injections are not an option. However, this must be done strictly under the medical supervision. So, apart from managing diabetes, glucophage SR 500 mg is also beneficial for women with PCOS and also prediabetes and even weight loss in some cases. One of the biggest advantages of glucophage SR is that it does not cause insulin release from the pancreas, meaning it does not cause hypoglycemia or low blood sugar level on its own. So, one common question people ask is what is the difference between glucophage SR and regular glucophage? So, regular glucophage releases the entire dose at once, leading to rapid absorption. While this works fast, it also increases the chance of stomach upset, nausea, and diarrhea. Glucophage SR, on the other hand, releases the medication gradually over the time. This leads to better blood sugar control and significantly fewer digestive side effects. So, most doctors prefer glucophage SR because it is better tolerated, requires fewer doses, and provides steady glucose control throughout the day. Now let's discuss who should take glucophage SR 500 mg and who should avoid it. This medication is primarily for individuals with type 2 diabetes. It's one of the first line treatments recommended worldwide. It is also useful for those with prediabetes. If your doctor finds that your blood sugar levels are high but not yet in diabetic range, they may prescribe glucophage SR to prevent the diabetes. For women with polycystic ovary syndrome or PCOS, glucophage SR helps reduce insulin resistance, which is a common problem in PCOS. It can also help regulate menstrual cycles and improve the fertility in some cases. It is also beneficial for patients struggling with metabolic disorders such as insulin resistant syndrome, where the body has difficulty using insulin properly. However, glucophage SR is not suitable for everyone. Patients with severe kidney disease should not take it because it is eliminated throughout the kidneys. If kidneys function is poor, is not working, the drug can accumulate in the body and lead to lactic acidosis, a rare but serious condition. People with severe liver disease, heart failure, or a history of lactic acidosis should also avoid this medication. Additionally, if you have diabetes ketoacidosis, which is a medical emergency, this drug is not suitable. You need insulin instead. So always consult your doctor before starting glucophage SR 500 mg to make sure it's safe and suitable for you. Now let's talk about how to take glucophage SR 500 mg properly to get the best results. The usual starting dose is 500 mg once a day, usually with your evening meals. Take it with food, reduces the stomach irritation and improves the absorption. If needed, your doctor may gradually increase the dose every 1 to 2 weeks. The maximum dose can go up to 2000 mg per day, split into 2 doses. It's important to swallow the tablet whole. Do not crush, chew, or break it. It can disrupt the slow release mechanism and cause sudden absorption, which is leading to more side effects. Drink plenty of water while taking the glucophage SR to help eliminate the drug efficiently and reduce the risk of lactic acidosis. Now, what to avoid? So, do not skip doses frequently. This will reduce its effectiveness. Do not suddenly stop taking it unless your doctor tells you to. Avoid excessive alcohol consumption while taking this drug, as it can increase the risk of lactic acidosis, a rare but serious condition. Taking glucophage SR correctly ensures the maximum benefits with minimal side effects. Like any other medications, glucophage SR mg 500 mg has some potential side effects. Common but mild side effects includes nausea, bloating, and mild diarrhea. These usually improve as your body gets used to the medication. Some people notice a metallic taste in the mouth. This is harmless but can be annoying. Loss of appetite or minor digestive discomfort may occur in some individuals. Serious side effects are rare but important to know. Lactic acidosis, this is extremely rare but serious. Symptoms include extreme weakness, deep breathing, confusion, and dizziness. Seek medical help immediately if this happens. Vitamin B12 deficiency, long term use may reduce the B12 levels, leading to fatigue, nerve problems, memory issues. So, taking a B12 supplement can help. Severe allergic reactions. If you notice rash, swelling, or difficulty in breathing, stop taking the medication and see a doctor immediately. Now, what is the good news? Most people tolerate glucophage SR very well, and side effects usually improve within a few weeks. Now, many people wonder about the difference between glucophage SR and regular glucophage 500 mg. The biggest difference is the release mechanism. Glucophage SR stands for sustained release. This means it dissolves slowly in the body, providing a gradual effect over time. Glucophage 500 mg regular is an immediate release version which is absorbed quickly, leading to faster action but also a higher chance of side effects. Now, dosing frequency. So, glucophage SR is taken once daily, making it more convenient for patients. Regular glucophage 500 mg needs to be taken 2 to 3 times per day, which can be harder to follow. Now, the side effects. Glucophage SR is gentler on stomach with fewer digestive issues. Regular glucophage has a higher risk of causing bloating, nausea, diarrhea due to its rapid absorption. Because of these benefits, doctors often prefer prescribing the SR version for better patient compliance and tolerability. A common question is glucophage SR 500 mg can help with weight loss? The answer is yes, but with conditions. How does it help? It reduces appetite, so people naturally eat fewer calories. It improves the insulin sensitivity, preventing excess fat storage. It reduces fat accumulation in the liver, helping with overall metabolic health. For women with PCOS, it may aid in reducing weight gain linked to the insulin resistance. But let's be clear, it's not a magic weight loss pill. Results vary from person to person. It works best when combined with healthy diet and regular exercise. So while glucophage SR can help with weight loss, the best results come from making lifestyle changes along with the medication. Now, how to minimize the side effects? So, if you experience side effects of glucophage SR, don't worry. There are too many ways by which you can minimize them. The best strategies is to reduce the side effects. Includes always take it with food. This reduces the nausea and stomach discomfort. Start with lower dose. Your doctor may begin with 250 mg and gradually increasing it. Increase the dose slowly, jumping to a high dose too fast increasing the risk of side effects. Stay well hydrated. Drinking enough water prevents dehydration and reduces the discomfort. Avoid excessive alcohol intake because alcohol and glucophage SR together increase the risk of lactic acidosis, a dangerous condition. By following these steps, most people tolerate glucophage SR very well. Now let's talk about what you should eat and what to avoid while taking Glucophage SR 500 mg. So best foods to eat include high fiber foods like whole grains, vegetables, legumes, which slow down the sugar absorption and improve the gut health. Lean proteins, chicken, fish, eggs, and plant based proteins help stabilize the blood sugar level. Healthy fats like nuts, avocados, and olive oil support the overall metabolism. Low glycemic fruits like berries, apples, and citrus fruits don't cause sudden sugar spike. Plenty of water, staying hydrated helps reduce side effects like nausea and bloating. Foods to avoid include sugary drinks like sodas and artificial juices can cause blood sugar spikes. Refined carbs like white bread and pasta break down quickly, raising the blood sugar level. Fried and processed foods contain unhealthy fats and additives that interfere with the glucose metabolism. Alcohol should be strictly limited as it increases the risk of lactic acidosis. A balanced diet along with glucophage SR can greatly improve the diabetes management. Now let's go over what kind of drug interactions are occurs with the glucophage SR 500 mg. So common drug interactions include other blood sugar lowering medications. If you take insulin or sulfonylureas like glipizide or glyburide, there is a higher risk of hypoglycemia, অর্থাৎ means low blood sugar level. Diuretics means water pills. Medications like furosemide, hydrochlorothiazide can affect the kidney functions and cause the dehydration, increasing the side effects. Corticosteroids, prednisone and dexamethasone can raise the blood sugar level, which reduces the effectiveness of glucophage SR. AC inhibitors, blood pressure medications like lisinopril, lamipril may lower the blood sugar too much, increasing the risk of hypoglycemia. Iodine contrast agents used for CT scans or X-rays, this can trigger severe lactic acidosis when combined with glucophage SR. So always confirm your doctor before undergoing imaging test. Always inform your doctor about all medications you are taking to avoid the dangerous interactions. Now let's wrap up with some frequently asked questions. Can I take glucophage SR on an empty stomach? No, it must be taken with food to avoid the nausea, stomach upset, and acidity. How long does it take to see the results? Some people notice improvements in blood sugar within a few weeks, but full benefits can take 2 to 3 months. Can I stop taking it if my blood sugar is normal? No, blood sugar can rise again. If you stop suddenly, you should ask your doctor before the stopping. Will it cure diabetes permanently? No, diabetes is a chronic condition. However, glucophage SR helps manage, but permanent cure is not possible. Is it safe to take long term? Yes, many people take it for years without issues, but regular kidney function tests are recommended. What should I do if I miss a dose? Take it as soon as you remember. If it's close to your next dose, skip the missed dose. Don't double it. Can I take it with other diabetes medications? Yes, but always under medical supervision. Some combinations may increase the risk of low blood sugar. Is it safe during pregnancy? Sometimes doctor may prescribe it for gestational diabetes, but it depends on individual cases. Always consult your doctor first. Will it interact with other medications? Yes, as we discussed earlier, glucophage SR interacts with insulin, diuretics, corticosteroids, AC inhibitors, and iodine contrasting agents. Always inform your doctor about your medications. Does it affect kidney function? It does not directly damage kidneys, but if your kidneys are already weak, it can lead to lactic acidosis. That's why doctors monitor kidney function before and during the treatment. So that's the wraps up of our detailed discussion on glucophage SR 500 mg. I hope you found this video helpful and informative. If you did, make sure to hit the like button. It really helps this channel grow and reach more people who needs this information. Don't forget to subscribe to stay updated on more medical and pharmacology related contents. Turn on notifications so you never miss out on our latest uploads. Have any questions or personal experiences with glucophage SR? Drop them in the comments below. I would love to hear from you and answer your queries in the future videos. Thanks for watching. See you in the next video. Stay healthy and take care.